Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here, and today I want to talk about a class of drugs that I'm sure you've heard of. They're on the commercials. Oddly enough, people are getting good success with them. I'm going to talk about the GLP-1 agonists. So I'm talking about things like semiglutide, otherwise known as Ozempic or Wegovy, tirzepatide, which is also known as Mounjaro or Zepbound, and there's other ones too, such as Trulicity. The main goal of these drugs is to help with blood sugar control, which leads to weight loss, and also to suppress appetite. And we're going to talk about some of the science behind them. So first, what are they? So GLP-1, that stands for glucagon-like peptide 1. So these are natural hormones that are produced in the intestines, and their main role is to regulate glucose metabolism, and they promote insulin secretion, so that helps get sugar out of the bloodstream. So the GLP-1 agonists are the synthetic form, and they basically mimic the action of the natural hormone. They are typically injected, but there are oral forms as well. So their mechanism is that when the blood sugar is elevated, these agonists stimulate the release of insulin from the pancreas. But a key point here is they only do this when the glucose levels are too high. So you can think of glucagon and insulin as opposite hormones. Insulin takes sugar out of the blood and into the liver and muscle, whereas glucagon basically is a hormone that does the opposite. It does what's called gluconeogenesis. It creates sugar to be pushed back into the blood. You know, sometimes this will happen if you're hypoglycemic, if your blood sugar is too low, or perhaps if you're in a fight or flight state. Another mechanism is they slow gastric emptying. So what does this mean? The food in your stomach will leave a little slower, which can lead to a prolonged feeling of fullness and satiety, which can reduce your appetite and decrease overall calorie intake. So this drug also helps support the beta cells. The beta cells are the cells inside of the pancreas that create insulin. And as we age and become closer to prediabetes and diabetes, those beta cells start to become somewhat dysfunctional. All right, so that's how they work. How about side effects? All drugs have side effects. These ones you've probably heard on the TV: nausea, vomiting, diarrhea, constipation, which I want to talk about in a second, pancreatitis or swelling of your pancreas, and even thyroid cancer. So now we're going to get into my opinion a little bit. So that's problem number one for me. I don't like the slower gastric emptying. It can cause gastric paresis, first of all, but one of the things I find concerning is something called SIBO. SIBO is very common, which stands for small intestinal bacterial overgrowth. That's when food is allowed to sit in the small intestine, which is the next stop from the stomach, for too long, and there's a small amount of bacteria that reside there, and if food is staying there for too long, they get to digest more of it, and then what happens next is they proliferate and they produce a lot of gases, and depending on the type of bacteria present that are proliferating, it can cause certain gases like hydrogen sulfide or methane are produced, and these can cause constipation or diarrhea, or alternating constipation to diarrhea. So that's where that symptom most likely comes from, and there is preliminary research on it, but it's still kind of new, so we're still learning more. The other thing, too, is the small intestine is where B12 is gobbled up. So one of the symptoms of SIBO is a B12 deficiency. And the other thing that typically will happen with SIBO is some reflux. So this is probably a little bit opposite of what you've heard and read about with reflux. You know, it's often blamed on a diet too high in acid. Well, what happens with SIBO is those bacteria produce a ton of gas, and that causes the LES, the sphincter, the lower esophageal sphincter, to open up because of a buildup of abdominal pressure. And then some acid regurgitates into the esophagus causing GERD. So it doesn't matter if it's a lot or little, any acid in the esophagus will cause reflux. So that's problem number one. Problem number 2 is just the lifestyle stuff. So if you're having trouble with weight loss and your blood sugar is out of control, there are things that you're doing that you need to get to the bottom of to address. And when you take a drug like this, then basically you're able to keep your habits that are probably inhibiting your weight loss in the first place. So it's kind of a Band-Aid approach. The other thought I have that I don't love about these drugs is they're known to cause some muscle wasting. And more and more research is coming out these days just how vital muscle is for longevity, for everything. The more muscle you have, the greater, like sort of a sink of muscle tissue that you can soak up sugars. So to have more muscle means you become more insulin sensitive. Now, I have to clarify here, I'm not a medical doctor, I'm a physical therapist, that's my training. So I can't tell people to take it or not take it. These are just opinions right now and just some trends I've been seeing lately. I do see people get a lot of benefit, and there's a lot of people that probably need that push initially to get some weight loss going, especially if they're high risk for cardiovascular disease or stroke, because cardiovascular disease and stroke are highly tied to diabetes. I just want to give some food for thought, because if you are experiencing some of those symptoms, such as reflux, constipation, diarrhea, B12 deficiency, or you've noticed muscle wasting, maybe it's time to talk to your healthcare practitioner and see what the best course of action is for you. Oh, and I forgot one last point. So one of the reasons people are losing weight is because of reduced appetite. Now, certainly there's a lot of people that overeat, but I do have a lot of my patients track their calories, and what I find often is a lot of people are under-eating, right? Because weight loss is not just calories in and calories out. It's also a hormonal thing. So it's the balance of the both, right? So a lot of times people are under-eating, thinking they're doing themselves a favor, but what they're also doing is becoming very micronutrient deficient. And we know micronutrient deficiency leads to all kinds of issues. Okay, so that's where I'll wrap this one up. So a quick one. Just want to give you guys some ideas of how this drug works. Certainly a lot of people are benefiting from it. But if you're having symptoms, talk to someone knowledgeable in this department. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.